Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, well, you came all the way from Kentucky.
Yeah, from Kentucky.
Okay, so that was, what'd you tell me, about a 6-hour drive?
Mm-hmm.
Alright, definitely quite a bit of a ways. Now let me have you tell kind of everyone, I already know what's going on, but...
Okay. Basically I just have like this constant pain in my lower back. I feel it like to the point of tears after probably 2 hours of sitting. I can stand up and it'll lessen the pain. It's not where I'm like wanting to cry, but it's that, and then there's just like a lot of tightness up here that I notice. And I'm in beauty school, so I'm constantly round brushing people, and it's just it's really irritating.
Yep, trust me, we've had multiple cosmetologists in here, and that same, with the arms kind of being up all day and a lot of times standing. And then the worst is when you get when you get them in, then they're wearing heels and standing, because obviously with what you do, you're trying to look the part,
right.
And it just takes a toll on your body. Okay, so now that low back, I want you to describe that, because I know that's the chief complaint. So you were telling me roughly, it's like
if you ever get poked in the ribs, that's what my back feels like. Someone's just like constantly jabbing in the back.
And it's both sides across the low back.
Yeah.
Okay.
That's the best way to describe it.
Sounds great.
It's like the worst. Yeah.
All right, let me have you stand up. Let's go through some ranges of motion. So I'm going to have you first, I'm going to have you look all the way down and look around for me. Any pain, tenderness, tightness, pulling? No. All right, I want you to look all the way up at the ceiling for me. Any issues with that?
It's tight.
Tight, okay. Bring one ear to one shoulder. Any issues with that?
It's tight.
The other side for me.
Same thing.
Same thing, okay. And then if you rotate and look over either side, any issues with that?
It's tight.
So a lot of tightness. Granted, I'm going to imagine you carry a lot of stress in there, and then obviously, like you said, with the round brushing. And okay. Let's drop down to the low back now. I know this is more of the chief complaint.
Okay.
So if I have you bend forward at the waist for me. Any pain, tenderness, tightness, pulling, anything like that?
Pulling.
Pulling?
Mm-hmm.
Okay. Let's have you extend back like this. Any issue with extension?
That's like a little tight, but...
Okay. Now, does it stay in the low back, or does it ever travel down the legs?
Not down the legs.
Not down the legs, okay. Let me have you lean into one side. Good.
That's fine.
Into the other side. Fine. And then lastly, we're going to have you rotate.
That's really tight.
That's really tight? Okay. Now, I know the last time you said you got adjusted has been literally 17 years ago.
Mm-hmm.
So it's been quite some time.
Yeah.
Okay. So today, I guarantee is going to be a little bit different.
Good.
Let me have you lay face down for me. And then here, actually, let me have you bring your hands. Yep, right there. All right, so we are going to start off with scanning the body. We're going to go from that cervical spine all the way down, checking the leg length, and then we're going to check the symmetry from the right side and compare it to the left side here. So we're going to start off, I'm just going to palpate in. I'm going to be pushing in on the spine and the surrounding tissue. Let me know if anything is tender to the touch, okay? So we go
That is.
right there.
Mm-hmm.
All right, so we're looking right at the base of the cervical spine to the top of the thoracic, so C7, T1 area.
That is.
Okay, so now, yeah, right in that upper thoracic, that upper back.
Mm-hmm. Yeah.
Okay, right in the mid back there, and that one seemed like it.
Mm-hmm.
Okay, so all of this is actually,
Yeah.
that just, even right when I touch, he's tensing up quite a bit. Everything is, yep, okay, all that's tensing up. Jeez, okay.
I'm a grandma.
Yes, as she described to everybody, her friends call her the grandma, the abuela. Any pain on the right side joint?
It's uncomfortable.
Okay. Any pain directly over the sacrum?
No.
Okay. Or over the left side?
Yeah, it's
A
uncomfortable.
little bit more, it seemed like on the left. Okay. So we bring the feet together. She pulls a little bit short on that right side there. The right hip is raised up compared to the left. You see that right in through here. And then also, so we've got, with that right hip raised, it's a little bit raised on the lower part on the right side and a little bit right on the left here. Granted, I know it was when you were a child, very young child, you were told that you have slight scoliosis, correct?
Mm-hmm.
Okay. So it's still very slight. We'll go through and I'll make the adjustments, I'll have you sitting and we'll do certain things on one side compared to the other. So we're going to start up top here between that cervical thoracic junction here. Okay, and we're going to start with the T2 on that left side. We're going to drop to a T3 on the right.
Wow.
There we go. That's a lot of pressure that just got taken off the nerves there. Okay, take a deep breath in and exhale out.
Oh.
Good. One more time, deep breath in and out. Good. So recheck that leg length. Actually, it's looking pretty darn good, which is a good thing. Okay, so now this is the part I want you to sit up on the table for me and straddle the table, so one leg on either side, please.
Wow.
Alright, so we had 2 spots that I wanted to work on here. Okay, bring this arm up and over, and then the other one up and over here. With your thighs, keep them to the table. And I'm going to rotate you this way. Look over the shoulder for me.
Oh, wow.
Good. I'm going to rotate you this way. Look over that shoulder. So this one's a little bit lower here. There. And relax. Go face down again for me, please. Not too bad, right?
Not too bad.
Okay. Okay. Leg length is still looking good. Now we're going to drop down here into the sacrum. Now I'm going to stabilize right on the sacrum. I want you to raise the right leg up for me as high as you can. Any pain, tenderness, tightness?
Mm-hmm.
Alright, relax. And then the left side. How does the left side feel? Both?
Yeah, they're fine.
Both fine? Okay. What I'm going to have you do, I want you to lay on your side and face me this way, please. Okay, bring the bottom leg straight, top leg bent. Perfect. Just like that. Alright, flip to the other side for me.
Crunchy.
Bottom leg straight, top leg bent. Good, good. And then flat on your back. Okay, so from here, I just want you to relax your legs. Let me have control here, okay?
Okay.
So with this, we're going to do a leg pull, which means you're going to feel relief in the ankle, the knee, going up to the hip. Relax, relax, relax.
Ooh.
You feel that hip come in? Okay. Pull started. You felt all that you pulled there? Alright, I'm going to have you stand up. Come all the way up, good. And I'll have you stand right here for me. Okay, bring your arms out by the side. Good. I'm going to have you bring your hands up and over mine, please. Good. And lean back. I got you. Squeeze your elbows together. Good, good.
My dad likes to do that one.
A lot of people do try that. And I've had a lot of people try to say, oh yeah, let me get you. Why don't you? No, no, no. Alright, let me have you take a seat right here. Facing that way. Okay. Bring this arm up and over. Yep, that one up and over. So with this one, I want you to take a deep breath in and exhale out. Good. And that was already released there.
Yeah.
Okay, so now...
Oh, God. I'm getting clammy.
Now we're going to do the Y strap. So I promise you got nothing to worry about. This is going to decompress the spine. Maybe after this, your friends will not call you abuela.
Probably still won't go out.
Can I have you pull the bottom of your hair through for me? Perfect, thank you. Okay. And I'm just going to bring this below the chin here. And just relax right there.
Oh my god. Oh, that sound.
Relax, relax. Deep breath in and out. Breathe in and out for me.
I was wondering what my sound would be. My roller, because everyone's is different.
No, was that scary? It was like the hype kind of brought it up. But
It was like the wobbling at the beginning that makes it scary. Like, gonna pull your spine out of your head.
But overall, how did that feel?
Amazing.
Good. Yeah, just relax it, relax it. It's a powerful move.
Yeah,
It-
I'd say so.
It definitely, people don't realize. It's like, almost like getting hit. You gotta just lay, relax. That's why I always tell patients, deep breath in and out. And then while you're laying there, you start to realize, like, oh, wow. Okay, I didn't know I could feel better.
Yeah. That's nice.
Now, how would you describe it, though, to someone?
You're gonna ask me.
I ask everybody.
Kind of like when you were a kid, you'd crinkle up a piece of paper and then flatten it out afterwards. It kind of feels like that, like your spine's all.
Crinkled up.
Yeah, and then it just like relaxes. That's what it reminds me of.
Alright, let me help you out. Okay. So in the beginning, I had you look up, look down. Granted, I didn't think, you didn't have really any pain in the neck. It was just tightness. It was like tightness in every direction. So what do you feel now? Do you notice a difference?
Yeah, a huge difference. Like literally, it felt like I had to like, pull it over here, pull it over there, and I was like, oh, okay, cool.
Let me have you jump down to the low back. If you bend forward, bend backwards.
I mean, it's a little tender from just,
Well,
you know.
I literally just put a strap around your neck and
Exactly,
pull.
that, but it's not like the same feeling as before.
Okay. Now, one thing I do want to tell you, especially when you do start driving back, either roll up like a towel or a shirt and put it behind the lower back and just like place it right there.
Okay. My grandma gave me a pillow. I always forget to bring it on road trips.
Okay, see, that actually would work because
Yeah.
you know you don't need to like go and buy some big fancy thing for it.
Okay.
Granted, there are like some things on Amazon that you could always. Yeah, but you just need a little something just for those long road trips. Trust me, when we take long road trips, you always need that.
Probably pros.
Yeah, you always need, we try to not do long road trips now with a little one.
Yeah.
Yeah, that's not fun anymore. But so, what would you tell anybody at home who's never experienced a wide strap, or just say has never been to a chiropractor?
I think everyone should do it. I feel bad that I waited 17 years to do it again, but I mean, if you have any sort of issue, why not just come and get adjusted?
Yep.
It doesn't have to be like a constant thing, but you should do it once for
Yep.
sure.
At least try it out. So,
Right.
I mean, why you've seen the faces and reactions of all the
Yeah.
previous patients coming out.
I got to hear people before.
Oh, there was a good scream before.
That was a good scream. It's like, please don't scream like that.
But how did they all respond after when they were walking out?
They literally just have the glowiest, smiley little faces.
I'm telling you guys, this is why we make these videos. It's for people to see that you don't have to live in pain, that there is, a way to get relief. So
Yes, do it.
there you go, guys. Go online, schedule an appointment, and just let me help you out. Have a good one, everybody.